There it is.
Okay, so hi everyone. I wanted to present a case of dementia that I saw at the Memory Disorders Clinic this year. I find this case interesting because it demonstrates the need for thoughtful decision-making when utilizing Alzheimer's biomarkers in a clinical setting. So Miss B is an 83-year-old female who presented with her daughter reporting cognitive issues. Her family first noticed cognitive changes about 2 years ago. At the time of the visit, Miss B had been living independently. She had a history of dementia in her family. Her mother was diagnosed in her 90s and her sister was diagnosed in early 70s. MoCA at the time of our visit was 11 out of 30, and she had an MRI done at an outside hospital in 2021, which showed generalized atrophy and some white matter changes. Clinically, she met criteria for mild dementia, most likely Alzheimer's given her age and family history. However, her family wanted to characterize dementia further. So we obtained CSF through a lumbar puncture, well, Dr. Liu did, and we sent it for Alzheimer's biomarkers. Her results were that she had normal A-beta 42, she had slightly elevated total tau and phospho-tau, and mildly elevated p-tau to A-beta 42 ratio. So what does this all mean? The elevated p-tau and A-beta 42 ratio may be consistent with the presence of pathological changes associated with Alzheimer's disease. However, an abnormal p-tau to A-beta 42 ratio in the context of normal A-beta 42 may be related to other neurodegenerative diseases. If we reference the NIA's ATN research framework, Ms. B's biomarker profile would fall under the category of non-Alzheimer's disease pathological changes with negative amyloid, positive tau, and neurodegeneration, which, as you know, is measured by brain atrophy. So the differential in this case could be Alzheimer's disease, primary age-related tauopathy, or limbic predominant age-related TDP-43 encephalopathy. The bigger question for me was that how do I explain these results to the family and help them understand or make sense of it all? Ultimately, we ended up informing the family that Miss B had a neurodegenerative disease, which is progressive, and we started her on donepezil. Now, this felt really unsatisfying to me and made me wonder about the clinical utility of getting Alzheimer's biomarkers for patients at this point in time when we don't actually have a disease-modifying agent yet for treatment. So looking at a brief cost-benefit analysis of Alzheimer's biomarkers, it is an invasive test. It could potentially characterize dementia and provide families with more information about their loved one's disease. However, to what end? The results of the biomarkers profile can be confusing to interpret and explain to the family, and they can be inconclusive anyway. Obtaining biomarker profile could be beneficial in identifying patients who have early Alzheimer's disease for inclusion in clinical trials. It could also be helpful in cases where patients test normal cognitively in clinic, but caregivers express significant concern. As for the cost of the test, I actually went on the Mayo Clinic website and tried to look it up, and I could not find what it costs. We do know it's covered by Medicare, but that's about it. I guess what I'm really trying to convey is that while we've made some headway in identifying various biomarkers for Alzheimer's disease, we still don't know much. We don't know enough. And while we have these tests available, they should be ordered after a thoughtful consideration, weighing in costs and benefits in collaboration with patients and their families. Thank you. That's it for me.
Thank you, Avee, and best of luck.
Thank you. I'm trying to.
Career. Yep. So to introduce our grand round speaker today, I'm going to turn it over to Chris Eckstein.
Thanks, Rich. So good morning, everyone. So it's my pleasure this morning to introduce Puya Abbassi. I think probably everybody just about knows Puya. He's currently one of our PG4 residents. He completed his undergrad and master's work at UC Irvine, and then completed his DO at the Western University of Health Sciences, and has been with us for the last 4 years. He's going to be going on to an epilepsy fellowship at Beth Israel starting next year, and looking forward to hear what he has to say about societal perception of epilepsy.
Hey, thank you, Dr. Eckstein. And everyone can hear me okay right now?
Yep.
Great. I'm going to just open up this screen and start sharing my window. Well, thank you all so much. So as you all heard, this was a little bit of a light topic I figure I'd talk about, which was going to be a very narrow and focused one, perceptions of epilepsy in society. And this is going to kind of be a kind of drastic overview of our history with epilepsy. And so bear with me here. I'm going to try to make sure I keep this in under 1 hour. I'm joking. So before we get started, just want to make sure I have no disclosures. And my objectives for this discussion is going to be to recognize that we have a long and complex history with seizures and epilepsy, and to appreciate that there is a historical stigma that is associated with epilepsy and that it does affect our patients today. I think it's something that we often do not think about. And that we also, as a society, do perpetuate our misconceptions of epilepsy. That's through our laws, through our rules, and even through our entertainment media. And understanding that source of that perception can be helpful to us to provide better education, to promote better treatment compliance. And so that's what I like to hopefully convey today. Now, there we go. So just to go over some basic epilepsy statistics, just to glance at it, a 2015 study in the CDC showed that about 1.2% of the population had diagnosis of active epilepsy. And the 2006 WHO report says that they estimate around 50 million people or more have epilepsy worldwide. So what I'm trying to convey here is this is not an uncommon condition, but unfortunately has a very significant underrepresentation. And so that's going to be very important when it comes to how we think about this disease or condition, I apologize. So why is it important to understand this? I think that historically there's been a pretty interesting tug of war between the supernatural and the scientific beliefs that surround seizures. Even within a single time period, within a single society, we actually see vastly different ideas that kind of permeate through. And to better understand how we got to where we are today, we have to understand our shared history. And there's actually been a study that showed that there's actually a correlation between familial understanding of disease after their child's diagnosis and having fewer depressive symptoms and a better use of anti-epileptic drugs. So I think it's a very important thing. And I think one other interesting thing to kind of talk about is why does epilepsy have such a complex history? I mean, we talk about our different diseases of antiquity, and of them, epilepsy has a very interesting kind of profile. They are ephemeral, they're recurrent, they're kind of unpredictable in their timing. Oftentimes they don't have any visible symptoms when they're in the interictal period. And when they do occur in front of people, the patient can return back to baseline within an hour. And that oftentimes can allow itself to be open to a lot of interpretations, superstitions, maybe treatment proposals that can be formulated and then seem feasible at the time. So the other thing to think about is a seizure itself. When you see it, it's a pretty drastic, presentation, and that can actually, in the minds of people in the ages of antiquity, even to this day, cause a lot of misinterpretation as to this being some sort of a supernatural phenomenon. So now to kind of just go into it, I thought I'd give you guys a brief history of everything from the start. And just a disclaimer, this is not a comprehensive list of ancient societies and their beliefs. I want to emphasize that no single society, either back then or today, has a monolithic viewpoint. And it's like not a possible thing to do. I'm just trying to present some common prevailing beliefs from some of the very influential minds of the time. So let's go to the prehistoric ages. This is when we see what we think may have been the first signs of some type of understanding of seizures. We see trepanation, where people would put holes in the skulls of patients to see if they can kind of treat conditions. Now we see these in skulls and archaeological sites as old as 10,000 BCE and ranging from Europe, Asia, Mesoamerica. And the hypothesis is that maybe they were trying to treat some sort of abnormal behavior, perhaps even migraines or seizures, by allowing spirits to come out of the head. Some people actually were even known to be carrying amulets of their skull with them in their grave sites. They carry them around their neck And you can see that these people survived because in this skull, you see actually there's some healing occurring in the bone itself. So this person did not die immediately after this kind of a procedure. So what we're seeing is, at least what we think, that there's a mixed understanding of epilepsy. There's sort of a natural phenomenon superimposed with a supernatural etiology. There's a problem inside the skull, and we gotta get that skull, that problem outside. Maybe that's an evil spirit in there. So let's create a hole to get the problem out. So that's where we got that early kind of treatment. Now, fast forward to ancient Mesopotamia, and we're talking about our kind of first written documentation of epilepsy. And so we start seeing that practitioners at that time really kind of thought of seizures as being the supernatural phenomenon. And here's Sakiku. This is one of our most ancient medical texts, written around, we think, 1067 to 1046 or so. And in it, it mentions things like, there's a chapter which mentions epilepsy. It calls Antasabu, which is the hand of sin. Now, sin is the moon god. It is not actually related to the word sin that we use as, sinful. That's a different type of etymology. But in this kind of text, we talk about people that had rapid contractions that were caused by evil spirits invading the body, and they would treat it with spiritual intervention. And kind of following the Mesopotamia, that kind of period of time, we kind of hit a fork in the road in our understanding. So ancient India, around 500 BCE, the physician Atreya was actually describing seizures as apasmara, which translates to a loss of recollection or consciousness. And at that time, he was really a proponent of seizures originating from the brain, and it's not the result of a divine or demonic possession. And he even proposed treatments like treating the underlying cause of the seizure, dietary changes, humor rebalancing, and even at some point saying avoiding dangerous places that may result in injuries. I mean, this kind of sounds familiar to us. Now, going to ancient China, there's actually the medical text written by Chinese physicians around 770 to 221. And I don't want to butcher that name, unfortunately, so I just don't want to mess that up. But at that time, seizures were described as having various visceral organs as being the source. It's not that it was just the brain, but kind of each seizure has its own organ associated with it. And it tried to avoid the supernatural as a source of seizures. They were not the result of possessions. And they had proposed treatments using herbs and acupuncture, food therapy, massage. And the fork that kind of happens is when we go to ancient Greece and the kind of Homeric era. And at that time, there was a kind of interesting conflict between the beliefs there. Now, one of the prevailing notions was that epilepsy was actually a punishment from the gods. And they coined this term back then, the sacred disease. Herodotus, the famous historian, would actually describe that the Persian king Cambyses II was a sufferer of the sacred illness. And he said that he attributed the cruelness and the tyrannical behavior of the king as a symptom of the epilepsy. In those times, people would go and get treatments at these faith healing temples that were dedicated to Asclepius, the son of Apollo, who's the god of healing. And if you see that little rod he's holding with the snake, there's our rod of Asclepius that we have on our white coats. So this is a place that people will go and get treatment, both for by Hippocratic practitioners, I'll get to that in a second, and also these faith healers. So it's got a combo treatment plan there. Now, Hippocrates, around that same time, was of a different school of thought, and he actually authored this book that it was titled De Morbo Sacro, on the sacred disease. And he says, quote, "It is thus with regard to the disease called sacred, it appears to me to be nowise more divine nor more sacred than any other disease, but has a natural cause from the originates like other affections." He also was, interestingly enough, very appreciative of the stigma of epilepsy, and he proposed that people should go, when they feel an aura, go to private places and try to have the seizure away from the public view, because he understood that people had a divine fear that surrounded seizures. Kind of going to ancient Rome, we have, people that had a very complex belief system around it. Mysticism kind of surrounded epilepsy. People thought that it was a bridge to the gods. Actually, Heracles was, or Hercules, if you will, was thought of as a demigod that had epilepsy. Julius Caesar, interestingly enough, tried to actually bolster his epilepsy to the public as a way of showing that he is of divine connection. And so it was a very interesting kind of system there. Conversely, Galen, he categorized epilepsy as having this origination from the brain or other parts of the body, as he kind of titled them as idiopathic or sympathetic. And he actually was a person that coined the term aura, or which is a Greek word which means breeze, which was describing the cold feeling going up someone's leg and into their head. And also at that time, he also believed that seizures were related to cycles of the moon. And this kind of may originate to where epileptics were at some points in history called lunatics. Now, kind of fast forwarding to Europe in the Middle Ages, we take a hard turn in the wrong direction. Epilepsy was oftentimes conflated with psychiatric disorders, and they were also of the belief that there was some sort of supernatural phenomenon, demonic possessions, and kind of used terms in literature with demons and falling evil and lunacy. It was viewed as a contagious disease, as something that people should try to avoid being around others that had seizures. At the same time, though, in the Middle East, there was the Persian philosopher Avicenna, who tried to categorize seizures as being two types, one that comes from the brain and one that comes from other organs. He actually proposed that we should treat people with wild rue or esfand, which even to this day has had some limited studies that show there may be some anti-epileptic potential in mice. And we also, I mean, even to this day, still use traditionally esfand as a way to ward off the evil eye. And he had proposed that to treat and prevent seizures, avoid alcohol, avoid sleep deprivation, avoid overeating and oversleeping. So not too crazy far off. Which, kind of goes to talking about these ancients, like we talk about them as being, kind of radical in their beliefs, but really, I mean, for what the technology that they had at their time, they weren't so far off in some points. There were some ideas that were pretty close to what we kind of accept as possible treatments and prophylaxis today. Now, the Victorian area seems to have the biggest changes with it. Around, the 1830s to 1901, we see major inventions and advances in science and medicine, advances in both understanding of microbiology, but also understanding electricity. These are just a few things to kind of point out invention-wise that came out around this time. We have doctors like Dr. Robert Bentley Todd's paralysis, who talked about seizures being periodic evolutions of the nervous force, which give rise to epileptic paroxysms. And they could be compared. He actually was a colleague of Faraday, and he said that they can be compared to the electrical phenomenon described by Faraday under the name of a disruptive discharge. So we're getting a better understanding. We have Dr. Hewlings Jackson of Jacksonian March, who said that epilepsy is a name for occasional, sudden, excessive, rapid, and local discharge of gray matter. And we have people like Dr. Caton, who was someone who actually used a galvanometer to directly probe the surface of the brains of dogs and apes and showed that there was electrical activity that was produced by the cortex. That was later advanced on by Dr. Hans Berger, who was trying to actually use the brain waves as a way to prove his idea that he had initially, that maybe there was some sort of a telepathy between humans. After he had an accident when he was younger and his sister miles away felt the accident had occurred, he thought maybe there was some kind of a connection there. So we started really delving into brainwaves, and then he actually became one of our major inventors of the EEG in 1924, and became more interested in the electrical activity of the brain. So we've had some pretty significant advances in our ideas of seizures in this time period. Now, after kind of having gained all this understanding, we still have a very brutal and just not so distant past. And this is a pretty difficult slide to go through, but just talking about, epilepsy and seizures in the 1920s in Germany, I mean, these were considered, these people were barred from having children. There were forced sterilizations, extermination of disabled children under the age of 3. I mean, it was terrible. Even in the United States, there was a US Supreme Court case that actually legitimized the use of sterilization for people who were suffering from mental disabilities or epilepsy. They kind of lumped them together. And they said that the law in Virginia at that time did not violate the equal protection and due process clause of the Constitution. 24 states enacted involuntary sterilization laws as a result, and there was an estimate of over 59,000 people having been forcibly sterilized for various reasons up to the 1950s. And this is not the only; these are not the only places. This is many places throughout the world that had similarly just very tragic laws. And that kind of brings us to modern times. And just kind of going through everything, you may notice that there's a lot of misconceptions that still remain in modern society about seizures and epilepsy. And that's something that's propounded through literature, law, religion, workplace cultures, and movies and television. And we have the stigma that still persists to this day, both perceived stigma and enacted stigma by those around the patients. This is a quote that I found really fascinating, which was, "The history of epilepsy can be summarized as 4,000 years of ignorance, apprehension, and stigma, followed by 100 years of knowledge, apprehension, and stigma." Epilepsy has often been associated with social discrimination. People with intractable seizures feel that they are a liability. They feel that they're a constant risk of, falling, being unconscious in front of others, sustaining injuries. There's a social embarrassment that comes that they feel when they have a seizure. For instance, think about it. I mean, when they come to, they're incontinent of both bowel and bladder at times. Sometimes we use in the field, emergency rectal diastat, which can be very traumatizing for someone after they had a seizure. There's also a very high comorbidity of psychiatric conditions that associate themselves with epilepsy, which can really exacerbate the stigma. It's, for instance, depression, anxiety, panic disorders, social phobias. And when we see, we can actually see the stigma being used against epileptic patients in the workplace. And that's something that, we don't really consider, is that people are often overlooked for promotions or denied the right to even participate in many social activities. I thought I'd just give this little light list of some things that I came across. Joining the military in the US. It is a part of the Department of Defense rules that epilepsy occurring beyond the 6th birthday, unless they've been seizure-free for a period of 5 years without taking any medications, and having a normal EEG, is disqualifying for patients. So you have to meet a pretty strict criteria to be able to join the military. Pilot's license is very, very difficult without if any kind of history of epilepsy is documented. Jobs that require driving. Truck drivers are unfortunately barred from driving, or not driving, but doing that job. Getting life insurance is limiting. I mean, you oftentimes and if you can get life insurance, it's very expensive. It's considered actually a substandard high risk to the life insurance industry. Joining the clergy in the Roman Catholic Church even had its limits up until 1983, in a sense. Now, that's the canon law, and that was encoded between 1917 and 1983, that said that those who were epileptics were either not quite right in their mind or possessed by the evil one, and thus they were unable to be ordained because of that. And so it's kind of a difficult diagnosis when you think about it. Now, there are obviously some rules that have exceptions. As I mentioned, some of these places will allow you to be able to do some of these things if you've not had a seizure for a very long period of time without taking any kind of anti-epileptic medicines. And that's an important thing for us to recognize, because when we start an AED, we should make sure that we're starting it on someone that will benefit from it, because if we start it on everyone, then we oftentimes have a very hard time taking it off. And that can result in a lot of limitations in that person's life later down the line. I thought this was a very interesting quote. I'm not going to read the whole thing, but I just wanted to mention that Tony Coelho, who is a former congressman from California, wanted to become a priest, and he has a diagnosis of epilepsy. And his family, who's Portuguese and devout Catholics, said that as part of their culture, he felt that he was told that epilepsy meant that he was possessed by the devil. And as a result, he wanted to be a priest, but he decided not to go for it. And he instead tried to get jobs. Even though he had great grades, he would apply for jobs and had to check out that he had epilepsy. And so that meant that he was pretty much left working at a liquor store. And he quit that job and became very depressed and felt sorry for himself and started drinking a lot. And he even said he became suicidal. He had a big, revelation and had kind of made a big turnaround. And he's actually one of the primary authors of the Americans with Disabilities Act. So the feeling of shame and guilt still remains prevalent. And I think we have to consider that, even throughout the world, there are still to this day examples of people that carry these misconceptions with them. Some patients from certain African cultures view themselves as being witches if they have epilepsy. In Tehran, Iran, there was a study that was done in 2009 that said 17% of respondents in that city said that seizures are caused by the will of God, and that 28% of the respondents would not accept a marriage into of a family member to someone with epilepsy. In the UAE, 68% of respondents objected to their children marrying a person suffering from epilepsy. I thought that was a very drastic number. And the question is now, how do we perpetuate these misconceptions and stigma? And I think there's not blame, but there's definitely a lot of places to look at. Literature being one of them. I decided to just do a quick sampling of some novels that just had seizures as a possible central theme. There's the Andromeda strain from 1969. And this was written by by a doctor, Michael Crichton, who had a character, Dr. Peter Leavitt, who has epilepsy. And unfortunately, that epilepsy, as part of the story, was kept secret. And at a critical point in the plot, he suffers a seizure, and that causes the horror scenario to escalate. And in this kind of scenario, the skilled researcher actually is hindered from performing a necessary function due to epilepsy, which was represented as some sort of a weakness. Kind of by the same author, Dr. Michael Crichton, in 1972, he wrote The Terminal Man. And this one was a little bit more egregious in that the patient, the main character in this story, suffered from psychomotor epileptic seizures that caused him to behave violently and having no recollection of what he had done afterwards. And Crichton actually studied a study from 1965 that for the story that said that 36 out of 100 people with temporal lobe epilepsy showed aggressive behavior, and many of them had suffered from personality disorders. And interestingly enough, that some have actually asserted that this book was one of the main reasons why in the 1970s and 80s, it was not an uncommon thing for defense attorneys to try to get their clients acquitted by arguing that their criminal acts were actually caused by epileptic seizures. And it's not far-fetched for us to still be subject to these types of things from literature that affect us. I mean, how many times do we get an advancement in genetics and people start screaming about Jurassic Park and, oh, what happened there? Or when we have some kind of an interesting viral therapy viral vector therapy, and then people start talking about, I Am Legend as a, cautionary tale. I mean, so we do find ourselves very much kind of looking to these books as a way of guiding ourselves. Movies and TV. This one I thought was very interesting. There was a study that was done by Baxendale that reviewed 62 international films from 1929 to 2003. And that had characters with epilepsy, or seizures. In the movies, the authors noted that the male characters with primary epilepsy are typically portrayed as insane, immoral, and generally just dangerous. Seizures with women, however, were different. They portrayed the person as a victim to the circumstance, ineffective, incapable, pitiful, needing to be cared for, which is a very drastic kind of difference in how seizures are portrayed. I thought I'd share some little clips to kind of prove the point, because I decided to do a little clip hunting here. And just to give you an idea, these are all the seizures from season 1 of House MD.
That word stop.
She
Hey, Susan, it's a crash car.
what's wrong?
Help me there.
Oh God, is she all right? He's coming for me. He's burning me with his touch.
Let's get her on some Avee.
Please.
Smells
religious visions, symptomatic temporal lobe swelling. We don't want her to.
Oh, she's seizing. Tom,
Help me get her on her side.
Religious visions?
And next comes.
Honey, you all right?
she's seizing. Get her on her side. I need some Ativan. Okay.
What's happened?
She's having a seizure.
She's aspirating. Suction.
Come on, Elise.
Has he ever had any problems like this before? Any family history?
No. It's just me and Will.
Diazepam, 10 milligrams, start.
Right, what's going on?
Taking some precautions.
Just seizing. Help him. That's cool, mate. Calm you down.
She's seizing. Give me some Ativan. She doesn't want to be discharged. She's manipulating me. It's real. Check the finger sticks.
And just to kind of go from there, that was a count of 6 seizures, 5 of which were female, 1 male in the first season. I found that really interesting. One second. Now, here's a different scenario. This is the movie Logan, where Patrick Stewart's character, Xavier, has seizures, and unfortunately, there's a different location.
Who are you? No, I am. You're the man who puts me to sleep.
We both could use some sleep.
No! No!
What are you doing to me, Charles?
Come on.
So that's now this is Panic Room. Jodie Foster and her daughter who are trapped in a room, and they are now about to be in a pretty tough situation, but the daughter has a seizure. Now, one more example, and this is actually Andromeda Strain, the movie adaptation. In this movie that was adapted from the book is Dr. Ruth Leavitt, not Peter Leavitt, who is the character with epilepsy.
Your second quarter rest period has been canceled. Time RAs is reassigned according to crash program B.
Come on. Come on, she can't hurt you.
Wasn't she with Dr. Dutton?
No, it's epilepsy. Give her the injection. She'll be all right. Good girl. Thanks.
I'm scared. Oh, Lord, I'm scared. You'll be okay, Charlie. We're pumping pure oxygen through your lab now. We know Andromeda doesn't do well on oxygen. He's alive. Where have you been?
Levitt had a seizure. Epilepsy. The red light flashing at 3 per second brought on a fit. Why the hell didn't she tell us about it?
Probably no top lab would have her if they knew. Insurance, prejudice, all that crap.
From the Middle Ages.
Just just going back and looking at those kind of depictions I just showed you. Now let's go back to that first slide I mentioned. Male characters with primary epilepsy are portrayed as insane, immoral, and generally dangerous. Seizures make the women seem a victim, ineffective, incapable, and pitiful, deemed to be cared for. So it's unfortunate that we still to this day have perpetuated some of these, beliefs. Even with non-epileptic seizures, there's been an unfortunate misportrayal where the movies and shows actually depict non-epileptic seizures being a means for achieving some sort of a secondary gain. And this can actually have a lot of negative effects on our patients. Delivering the diagnosis of a non-epileptic seizure disorder is very difficult for us because it requires patients and families to understand and accept the diagnosis, but they oftentimes may feel that they're being accused of malingering because of how they see the portrayals on television. And that's a very difficult thing for us to have to, consider. Here is a scene from Code Black 2, and this is a very tragic situation.
He won't stop seizing. Did he get the Ativan?
Yes, just pushed it.
He's been seizing multiple times.
Workup's been normal though, right? Electrolytes, tox.
Yeah, all normal. I've been giving him Ativan for the seizures.
Hannah, get the Ketra. I got an airway kit ready. I think we need to intubate. Hold on. Brody, you can stop seizing now.
What are you doing?
Brody, stop seizing now. You're not fooling anyone. If your seizures were real, then your hand would have hit your face. Google it.
I can't believe you're saying this. What are you accusing me of?
So what'd you take to make yourself vomit? Ipecac, salt water.
Eye drops. Makes your heart rate go up too. Google it. I love the Ativan, by the way. Hell of a high.
Why would you do this?
Why not?
You accused an innocent man of abusing you.
Yeah, nobody's innocent, Doc.
Yeah, nice try.
So here we see that the character was using the non-epileptic spell as a way to get Ativan. And unfortunately, the actor who portrayed this, Cameron Boyce, did suffer from epilepsy off camera and in real life. And he passed away, unfortunately, 2 years ago from what is now suspected to be SUDEP. But it's not all bad. I would actually characterize that there's actually one interesting and very well done portrayal of seizures, and that was from the movie Garden State. And kind of listen to how this is discussed.
What are we laughing at you about?
I lied again. I have epilepsy.
Which part are we laughing about?
I had a seizure at the law office where I work, and they told me their insurance wouldn't cover me unless I wore preventative covering.
What's preventative covering?
The helmet I was wearing. Oh, come on. That's funny. That's really funny. I mean, I'm the only person who wears a helmet to work, who isn't like putting out fires or like racing for NASCAR. But what do you do? I mean, I can't quit. Their insurance is amazing. What do? You laugh, I'm not saying I don't cry, but in between, I laugh and I realize how silly it is to take anything too seriously. Plus, I look forward to a good cry. Feels pretty good.
Very different portrayal of a very realistic understanding of how there's overreactions and misconceptions around seizures that result in people being mistreated at work. So I thought it was a very interesting example. Now, how can these misperceptions and stigmas be dangerous? There are a couple of things to keep in mind. Just in television and movie depictions alone, oftentimes the study by Moeller actually found that there's a trend towards showing seizures being this very intense and chaotic event that needs immediate, decisive actions. And when you see these depictions, that actually mislead the public about the severity of seizures, and actually is quite contradictory to our advice that we have, which is to remain calm. So other examples to talk about is some historical ones. Annalisa Mickel, who lived in West Germany, she suffered from temporal lobe epilepsy since the age of 16, and anticonvulsants were not effective. And she started seeing faces of the devil and hallucinated that voices were telling her she was damned and going to hell. And so she started seeking with her parents, as she herself was very adamant about seeing a priest to get an exorcism. And actually, most of the priests refused to do it. But there was one priest that they found that did agree to it, and they performed 67 exorcism rituals over a period of 10 months. And she eventually died in a year from dehydration and malnutrition. Another interesting kind of example is something I came across a lot of people are familiar with in the Hmong culture, which kind of encompasses multiple different countries, but the people that there have a traditional belief that seizures are actually known as something called the spirit catches you and then you fall down. That's the term they use. And traditionally, seizures are treated with a shaman who tries to reunite the spirit and the body. And while epilepsy is recognized as a serious illness that can cause a lot of suffering, it is also kind of seen as a distinguished affliction or a spiritual giftedness. And traditional families who have epileptic patients, or who have people with epilepsy in them, those people would become eventually shaman. And so it's actually seen as a person who has an entry point into the spiritual realm that most of us are not able to go into. Now, some of these more ancient and traditional beliefs can have some very significant effects today, and also our misunderstanding and inability to communicate can create a compounding factor. So there's the famous story of Leah Lee, who was of a Hmong family from Laos, and she was born in Merced in 1982. She had her first seizure at the age of 3, and the family had interpreted this as the bad spirit that was taking her soul away, but that her body was re-inhabited by this healing spirit, which was a blessing. And the family had refused to give the prescribed anti-epileptics because they felt that their healing traditions were not respected by the medical community. And there was also a very difficult issue, which was there was poor translation between the doctors and the family because there were no Hmong interpreters present. And so this resulted in a lot of miscommunication, misunderstanding. And as a result of this, Lee went into status epilepticus in 1986, and then she had remained in a persistent vegetative state until she passed away in the year 2012. So my hope is that we can hopefully translate this into some action. I hope that we can try to promote better depictions of epilepsy in the media, and hopefully the media can use epilepsy or seizures as something, you know, that's not a tool for just additional drama, maybe as a source of education. And we can hopefully provide better education by trying to understand if there's any apprehension to the diagnosis or any, you know, misinterpretations or any type of traditions or beliefs that we need to also respect. As doctors, we should be aware of the implications that that come with this diagnosis. Epilepsy is a very, life-altering diagnosis for many of our patients. And so we have to be very cognizant of that and treat it with that respect. And also just help us understand that, maybe we should be viewing seizures differently, and that can help us better treat our patients by just providing an education that's more tailored to different cultures. And other thoughts, maybe we can also consider different types of, when we're prescribing these abortive medications that we send patients home on, we should consider things that maybe help reduce that burden of stigma. Things like intranasal options, nasal lamp, for instance, versus over the rectal options like Diastat, which has been a trend more and more recently that we've been trying to move away from Diastat for our adult patients. So in conclusion, I just wanted to, kind of overview-wise, is say that, we are not immune from viewing seizures through our own cultural lens, and that we, live in the information era, and we have understanding, a really excellent understanding of seizures, with a lot of holes still there, but we understand a lot. But we still carry with us a lot of outdated notions, and we should understand that ancient beliefs still to this day can remain stubbornly with us. I was reminded of this myself just recently when I had my wedding like a few weeks ago. And what was on the table at this traditional Zoroastrian Persian table in front of us was this, what you can see right here, which was a display of wild rue seeds made in a floral passion. And we still, have the rue as a way in front of us to kind of ward off the evil spirits from our marriage. And actually, the lack of burning of this S-fan was widely cited amongst some family members as the reason why we got COVID after the wedding. So that was an unfortunate result. So just wanted to say thank you, everybody. And I just really want to say thank you to all the mentors that helped me through this presentation, and the special mentors that really helped me through deciding epilepsy was and neurophysiology was what I really wanted to do. Dr. Eckstein, Dr. Sinha, Matt and Dr. Mantry and Dr. Fang, and also my brilliant colleagues, maybe Elijah, I guess, and also just really a thank you to our APP family who just supported us from our intern year to this day. So I genuinely thank you so much to Elizabeth and Erica, Mary and Sue and Tom. I just cannot say how much I enjoyed working with you all, and I will miss you all. So thank you all.
Thank you, Puya. So anyone with any comments or questions, put them in the chat box. We will miss you too, Puya, and congratulations on your recent marriage.
Thank you.
Does Hollywood have any regulations regarding how diseases are depicted?
No, and I don't think of, I can't say that I found any, but oftentimes a lot of these different.
They hire medical consultants, right? Don't a lot of these?
They do. They do. Unfortunately, those medical consultants sometimes are not, are talking about, or maybe there's someone that's not a neurologist that is now trying to help out with a, seizure scene. The International League Against Epilepsy does oftentimes try to help promote accurate depictions, and there are different leagues that are trying to do exactly that by providing more incentive for people to do more accurate portrayals on TV and movies.
Because when they're portrayed, it's always just frightening for everybody. But for the patient, there's mostly a big blank, right? It's for the patient, there's just darkness or unconsciousness. It's a different, very different thing, right?
It is. And I think that really kind of digs at what, I guess what I was talking about earlier, which was there's a very interesting perception of how the patient perceives the seizure and what the person around them perceives. And it's very, very kind of drastic. I mean, compared to a lot of other, of our diseases of antiquity.
All right, Joel, you have a question?
Yeah, Puya, thank you for that talk. I'm just wondering, is there an opportunity, instead of trusting movies to tell people what to do kind of a direct to public campaign to teach people what to do if they see somebody with a seizure, kind of like Fast for Stroke? I can't remember ever seeing something like that on TV or anything.
I think that is a really an excellent thing to bring up. And there was actually a lot of talk about this being the chance of a real good opportunity to educate, was when that actor, Cameron Boyce, that I showed that video of, who died of SUDEP, was like the hope that this would be a really good teaching opportunity for people to understand that epilepsy is, something that we need to be more aware of. And unfortunately, I don't think it's really it has been turned into something like a really widespread public effort. So I do think there should be something for seizures that we need to try to, at least on our end, make a public effort of trying to get out there, because I think it's important. People try to stick objects in people's mouths still. They still think people are going to swallow their tongue. There's a lot of dangerous things that are done with seizure response. And actually a lot of papers I read about how, this is dangerous, that we, portray seizure first aid so incorrectly on television, because that's where a lot of our people get their knowledge from. And so we try to teach our patients when we see them, but we need to do a better job of getting out to the whole, the whole public.
So a lot of good chat going on, especially literary. Brian McGrory, you have a question?
It's not really a question, it's more of a comment. I didn't actually know about that ruling from the Supreme Court that Puya brought up from the 1920s, but the actual current Supreme Court Chief Justice has epilepsy. So that's sort of an interesting, it's kind of serendipitous. He had he wrote about, he had his first seizure when he was actually an assistant in the Solicitor General's office. And now he had to take the bus to work for the first 6 months. And so, like, when I'm talking about, a person who has, recurrent unprovoked seizures, I always bring up this example and say, it's like, yes, you have to take sensible precautions, but there's definitely many, like, really important people who can live kind of full, healthy lives despite having a tendency to have seizures.
Yeah, and I think there's a lot of, a lot of people don't realize there's a lot of famous actors that who are trying to even, they try to let people know that they are epileptic, they're people with epilepsy, and they are trying to, get that out into the public, but it's not really something that gets out much, which is strange. There's actually, like, you can, I was reading up online on all the different, actors who have discussed that publicly, their history of epilepsy. I feel like there's so much to be gained from people learning that you can still be able to do a lot of the things that, you want to do, that most of the things you want to do, even with this diagnosis. But I think that would be really helpful if there was more of a public effort.
Dr. Shaw, Himan Shaw, you had a comment or website?
Yeah. So there is a very good website, talkaboutit.org, where Hollywood actors talk about the seizures. I usually give it out to my patients, mostly younger people that may listen to the Hollywood actors better than they would listen to me. So just a reference. It's a talkaboutit.org.
Thank you for sharing that. Yeah, that's great. I actually will look into this too. Thank you.
Thank you. That's great. Mike Pytak, do you want to talk about Dostoevsky? Is Mike out there? He's looking for the unmute, maybe. So Mike talked about the idiot in Dostoevsky. Can't say I'm particularly up on that, but anyone interested? And Kim Johnson throws in some kudos for The Spirit Catches You and You Fall Down. Kim, can you comment? Maybe not. She's on her iPhone. Oh well, so it's all in the chat, everybody. Anyway, don't forget the photo next week, right after Grand Rounds. And Puya, thank you so much, and we will miss you too.
Thank you so much, Richard.
In big letters, not small little ones.
Thank you. Thank you so much. I appreciate it.
All right, everyone, be safe.
Take care.
Bye-bye.